Hello, everyone. This is Conversations with Winsala. And today we have our delectable, I would say, you are first responders, right?
Yes, you can call us that.
Or you're part of
You can call me
the
that.
legion of first responders. So we have Jade Sola on our show today. And I guess we are trying to, have a nice roundabout, how will I say this? How technology is helping to ease the way of life. And we have someone who is in the medical field to discuss that with us today in the form of Jade Sola. So before we even dig into that, how have you been now? How is the fiancé life going? For those that don't know, she got engaged last year, in November, October. Yeah,
October.
October. Yes, October.
Thank you. Hello, everyone. Thank you, Sean, for having me on your podcast.
Yes.
This
So
is my first podcast. I'm feeling like a celebrity.
yeah, celebrity. I mean, I'm trying to get you on this for like. I mean, we're trying to get this done for a while now, and it's
I know,
yeah,
right?
partly my fault because logistics problems.
That's okay. That's
Mm,
okay. I'm glad to be here. Everything's going well. Fiance life is going amazing.
mm,
The process, the initial process is the hump to get over, but
yeah.
after, like the venues and everything will be much smoother. So,
Mm,
I'm happy to be here. Everything's going well.
yeah.
Life is good.
Mm. So before I came on today, I had gone to the gym. Today is a leg day. I'm trying to do like, I won't say an event, but like a
Mhm.
day where, or maybe like a week where I'll have all my friends come around, go to the gym, and just
Mm.
do different types of workouts,
Mm-hmm.
and you know, maybe get. I mean, I used to train people, so I know a lot of things.
Yeah.
But I guess it's leaving me gradually. Like I don't remember some of those things anymore because it's been while I've trained people. But
No, I think that's a good idea because I think what people need, let me not speak for people, I'll speak for myself. What I need is accountability.
mm,
And so I think if like people are going together, it's just a level of accountability that'll
yeah.
keep encouraging you to go. So you should start it. That's a good idea. That's a very
But it won't be a continuous thing. It's just like maybe 1 week thing.
okay. Oh,
Yeah.
like a training, like,
Just
1 week.
yeah, I don't want to call it training. You know, just like coming together, like, okay, let's work out this week. Today we'll do leg day, tomorrow we'll do cardio, the next day we'll
Okay.
do
Arm
like,
day.
yeah, like just. And I want to make it such a way that it won't be too I would say gender specific. It's something that everybody can do, because
Okay, okay.
yeah, makes it
That makes
fun, because you don't want some people doing bench press, carrying, I mean, lifting 180 pounds, and people cannot
one
lift. Yeah.
That's true. That's true. You should
Mm.
start it up. I'll be there.
Yeah, I'm silently telling you, like, it's coming. It's to come.
You heard it here first.
I know you are a fitness buff too, so just training out there. But yeah, that's something I'm planning to. And plus, it's like help. You're in the medical field, so you know more about
Yeah,
fitness and all that.
I think
So
it's a good idea.
yes, so Daddy, tell us about yourself. And you know what? I don't like that question. I don't like it. Like, oh, you meet someone and say, "Tell me about yourself." Like, where do you want to start from?
Lord, where can you start?
Like, I was born so
I
yeah.
was born in New York.
But I guess, let's say, how did you get to this point? I'll start from like, what do you do for work,
Okay.
without stating where you work specifically for security
Okay.
reasons. Yeah, more like where you do for work. How did you get to this point?
Okay.
Let's start from there.
Okay. Okay. We can start there.
Mm-hmm.
So I am, hi everybody. I am a registered nurse. I am specializing currently in fertility and in vitro fertilization, otherwise called IVF.
Mm-hmm.
I started as a medical surgical nurse, which involved caring for a very diverse adult population with a wide range of conditions. I was working 12-hour shifts, both day and night. Quickly realized that this role was not for me, especially the work-life balance. I just did not think it was sustainable for
Yes,
me.
I was part of that journey too. I was part of
Yes,
that
I
journey.
know you said you did night shifts. It's not sustainable. I would never recommend. I know sometimes we can't avoid it, especially
Mhm.
within healthcare and specific fields in general, but night shift in general and long hours is just not healthy long term. But
Mm.
anyway, I quickly transitioned, not quickly, but I recently, as of maybe 6 or 7 months ago, transitioned into my current role, which is the IVF nurse coordinator. So it's a lot more my speed due to the work life balance. But more specifically because of the passion I've always had for women's health, and women's reproductive health, more specifically.
Mm.
Hmm.
So my question, like this is just off, like just off script.
Yeah.
Is there a reason
Hmm.
why in the medical field you guys do 12-hour shifts?
I think it's for a sense of continuity of care. So I think it just has to do with the continuity of care. So you have a day shift and then you have a night shift. I think in some places there's maybe like a middle shift. So some people work 8-hour shifts instead of 12-hour shifts.
Mm.
The I would say the plus side working 12-hour shifts as a registered nurse is, at least in my own from my own experience, you work 3 days a week. So you'll work 3 12-hour shifts per week. And so the other days you have off.
Mm.
It was nice, but in the same breath, the shifts are so exhausting and it's not really ever a 12-hour shift. You're probably there for at least 14 hours plus sometimes if it's a more hectic shift. And so the days that I have had off, I would just spend them sleeping.
Mm.
So I think it's just more so just the patients are able to establish some consistency. So it's not just like a quick couple hour shift. You're able to manage this patient for uh, a a long period of time before passing it off until the night nurse.
Because man, I just feel like 8 hours is enough to do whatever you want to do because even 8 hours is a lot.
It's a lot.
It's a lot.
It's a
But you
lot.
guys, you guys are really trying. So, but back to how you got here. So, um, I would say, what schools did you attend, and
Mhm.
what certifications did you have to get to where you are doing right now? Because so I'm going to ask you like difference between the
Mhm.
different types of nurses that we have: registered nurse, another
Okay.
one. Then what's the other one?
There's LPN
All those
license.
ones, yeah, like the people that draw your blood. Like I'm just like confused. Right? All of you are not nurses. You're all nurses, but you know.
Yeah, so that's a good question. So there are different routes that you can go. So I went to school in Alabama. Don't ask me how I ended up in Alabama, but I went to Auburn University, War Eagle. If you know, you know. I know you're
Auburn
like,
is not bad though. Auburn is a nice school.
Auburn was a very good school. Their
Yeah.
nursing program is also good. So I started in Auburn University. Nursing, you can go a couple different routes. Some people go do an associate's degree and you can become a nurse that way.
Mm.
Getting your associate's degree involves 2 years. Um, Getting your bachelor's degree would obviously involve 4 years of schooling, with the last 2 years being more nursing specific. And then there are others who go the route of LPN, otherwise called licensed practical nurse. And that's typically a 2 year program in which you are just doing like nursing specific classes, and then you get a certification at the end and you become a nurse. I think nowadays a lot of positions are requiring um, a bachelor's degree and above, in specific areas. I think you can still of course get your associates and you can still become an LPN, but I think they're encouraging a bachelor's degree, um, which I also think, if possible, is also good because, eventually more spots are that's just what they're requiring. And it would also open up the gate for more, maybe like leadership positions,
Mm.
managerial positions within the nursing field.
Mm.
So the route I took, I went to get my bachelor's degree, which involved 4 years. And then once you graduate, you're not a registered nurse at that point. You have to now pass the NCLEX exam.
Mm-hmm.
So once you pass this exam, you then become a licensed registered nurse, and that's how you seeing the title RN at the end. So it's, they're different. Everybody is a nurse, like whichever route you go. I think the difference is just, you'll have, depending on the route you go, you may be able to do more than another type of nurse. The pay may be more as will be more as a bachelor's graduated nurse versus like an LPN program. So those are just some of the differences you might face.
So what's the highest level you can attain as a nurse?
You can you can go back for your master's degree. You can get a doctorate in nursing as well.
Mm-hmm.
Um, so I would say the doctor of nursing is the highest that you can go. Some people go the route of, maybe they don't want to do clinical work. So, you get a master's in nursing, or you do like an administration role. So, you can go back to school, you can do your master's, you can go on to do nurse practitioner, nurse anesthesiologist. So they're different. It's a very flexible and wide field depending on what you want to do.
So nurse practitioner is those that can say attend to you like a doctor, right?
Yeah, so it's more of a provider role compared to being a registered nurse. So once you're a nurse practitioner, you're operating more in a provider type of role. I think the main difference is being able to prescribe certain medications.
Mm.
I'm not sure that a nurse practitioner can have, I think in certain states you can operate in your own clinic, but not in every state. You would need to be in a physician role to do so.
Mm.
In most states.
So you said you made mention of provider role. What does that mean?
Provider, as in, how patients will they refer to physicians as your provider. So that's what I mean by provider, just like that practitioner role who's able to prescribe you medication, who you go to.
Mm.
That's what I call like my network, my healthcare team. Like my physician is my provider.
Oh, okay,
Yeah.
that makes sense.
So it's just a general term to describe like your network.
Yeah.
The people.
So this is very Americanized, American
Mm,
centric. Because I know in Nigeria we have like some clinics, like we have hospitals and we have clinics. And I know that
mm-hmm.
some of those clinics is the nurse that is like attending to patients,
Mm.
prescribing drugs and things.
Okay,
Yeah.
interesting.
I mean,
Okay.
growing up, I used to have malaria a lot, malaria, typhoid, all those things. But thank God I'm free of those things.
Oh,
So
amen.
yeah, so we used to we'll go in and I guess there were not many doctors, and
Mm,
even till now, like the doctor per say 10,000 is very very low. The ratio is very
mm.
low. So yeah, so you see a lot of such situations where nurses prescribe.
Are the main ones that you see.
Yes, so that's why like
Okay.
it's always confusing when they say, "Oh, she's a nurse," or she's the
Okay.
what do you call them again? Chief nursing officer, and that means she
Okay.
can prescribe drugs. So even when I was in boarding school,
Mhm.
there were the nurses that were handling the sick bay. So when you are sick, you just go in there. You meet the nurses there, not doctor in the school.
Okay. Okay.
Yes.
I think I think as a patient you will see the nurse a lot more than you would see the physician. So, I mean, the physicians will prescribe medication, they'll come and assess, they'll be your main, I keep using the word provider, but that's the way we consider, like that's what we just call that network. So they come into the room, at least when I was working, they'll come into the room, they'll assess the patient. But as far as being the nurse, you're pretty much with that patient the entire 12 hours of the day. So
Mm,
you kind of see what's going on with the patient a lot more. You're doing it's more of like medication, doing your assessment in the beginning of the day, documentation on this patient,
mm,
communicating with the physician and the rest of the health team, physical therapists that they work with throughout the day. So you see, as a patient, you'll see the nurse a lot more, and then the doctor's kind of like in and out.
mm.
Um, so that's
So
kind of how it looks like here.
so that's for those that are what do you call them that are in the hospital. What do you call
In the
them?
hospital, yeah, I'm speaking from, the
Yeah.
perspective of
So I'm talking about
nursing.
those that just okay, I'm sick, I want to visit the hospital.
Oh, okay, yeah,
Yeah, that's
yeah.
what I meant. Yeah,
Okay, okay, that makes
yeah.
sense.
So the end, it's end clicks, right? Is that what you call it?
NCLEX, yeah, it's the board exam for nursing to become licensed.
So which one is the one that the doctors take? Because
They take the MCAT, but honestly, there's so many other exams that I think there are other exams that they continue to take. I've even like called STEP. I have so many physician friends, and I've lost track of the amount of exams they have to take. But they take the MCAT. I think MCAT is the equivalent of NCLEX
oh, okay.
for nurses. Yeah.
So the reason why, okay, now I see why I thought is the NCLEX that doctors take, because I guess a lot
Okay.
of nurses are always like posting, oh, I just passed my NCLEX
Uh,
exam, I'm not a registered nurse. So I guess that's why, because
yeah.
people are trying,
Okay.
man. People are, because I can't imagine. So first things first, I don't like hospitals, I don't like clinics, I don't like
Mm,
the smell of drugs, smell of
mm.
blood, all that. Like I cannot do it. Like it's not me. And that's why I went to
Yeah.
go and do my engineering JJ, like, let me just fix my engineering, computer numbers, and then we go home. So
It's definitely not for everybody at all.
so is it something that for you, why did you why did you decide to go into this field?
I didn't really grow up knowing like, oh, I want to be a nurse or I want to be working in a clinical space.
Mm-hmm.
I just knew that, as I got older, I knew as ge- as gen- as generic as I feel this answer will be, I just knew I'm a very empathetic person and I wanted whatever role that I'm in, I'm able to directly work with people and I'm able to impact people in a positive way. I didn't know what that looked like, but I knew that's just what I wanted my role to entail.
Mm-hmm.
And then as I went through college, I knew that I was more, excuse me, I was more passionate about women's health and specifically like reproductive health. So that's how I kind of entered my way into nursing. I think my first role, it was beneficial because I learned a lot in different ways about myself, what I do want in a role, what I don't enjoy in a role, and just about healthcare in general. Um, and so it brought me into my current role, which is ideally what I had imagined my role would be, just working in a space that I enjoy. So while I didn't know that nursing was where I would end up, um, I do appreciate how, I guess, versatile this field is in which you're able to explore until you find something that fits what you've envisioned.
Mm. So it's interesting because you said after like 1 year or 2 years in college, right? That's when you decided you want to be a nurse. But
Hmm.
in Nigeria, man, you have to know what you want to do as
Mm,
you're registering for the UME exam. So UME is the equivalent of the SATs, right?
yeah.
So before you write your SATs, before you write to any external exam, you have to decide, okay, I want to become an engineer. Then I will
Mm,
now inform what subjects or classes that you will take for the exams. You
okay.
cannot go into college the first thing and say, oh, I want to become a doctor, and you are in engineering faculty. So yeah, it's very. I guess the US is flexible. It has its own pros and cons, because
Mhm,
that freedom kind of when you're growing up, when you're like at that young
mhm,
age, sometimes you need that guidance. So when you have
mhm.
too much freedom, you can now, like, you become confused,
Yeah.
become
You
really
mean like the
confused.
different options that you have and not knowing?
Yes,
Yeah.
yeah. Because when you enter engineering, like, there are stipulated classes you have to take. Like whether you
Yeah.
like it or not, you have to take those classes. And some of those classes, they are prerequisites for you going to the next level. So if you don't pass those classes, automatically you have an extra year, or you have
Mm,
an extra semester. So that first year is very, very crucial.
very
Like, and
pivotal. Yeah.
funny enough, they're like more like 5 classes or 6 classes.
Mm,
And they're kind of difficult because you are changing environment from your high school into college, and
mhm,
the way things are being taught in high school is different from college. So this is Nigeria. So in Nigeria, you are being taught, like, teachers will come teach, But in college, they come in and they lecture. Lecture is like summary, like, okay,
Okay, yeah.
um, from X to, so from A, you get to Y. They'll not tell you
Mhm.
how, they'll just tell you, do this, do this, do this. They'll not
This
show
is
you
what it
how to
is.
get to Y. Yes. So
Mhm.
that change kind of affects how people study, how people see things. So the
Mhm.
first exam, the first result is always a like an eye opener. It's
Mhm.
going to jerk you back to life that, Mr. Man, you are now in big leagues. So a lot of people fail. A lot of people fail.
Yeah. And it's,
So
I don't even think it's, it's not always attributed to you don't know the information. It's
yes,
just
yeah,
like,
yeah, yeah, yeah. Mm,
it's learning how to take a test and,
yes,
wow, this is really how all
yes,
the information is thrown at you and you just
yep.
need to figure out what works for you to be able to study
Hmm.
properly.
I'll give an
Yeah.
example. Like, so in engineering, so when we were in high school, we had mathematics, we had
Mm,
English, we had chemistry. But in engineering, you have subjects, you have classes that involves like the theory
mm,
and the calculations. So for the theory part, you have to define a lot of things. You
mhm,
have to define this, define that, define this, define that. Then you now have like another section where you have to calculate. So if you're the
mm,
kind of person that you enjoy the calculation part, which was kind of things I struggled with my
mhm,
first 2 years. I
mm,
preferred the calculation part. So I didn't really used to like study hard on the theory where you have to like define things,
mm,
compare and contrast. So then when the exam comes, I struggled at that part, then I excel in the other calculation part. But for you to get
mm.
the full grades, you have to have holistic, view of everything. So that's where,
Exactly.
and you need people to tell you this, but people don't do that. They don't
Yes.
get that.
Yeah,
Yeah.
that's similar. It's similar to taking tests in nursing and even through the NCLEX. It's very hard to just get the information and then you can't really just memorize information and just learn. You have to really apply the information that you're learning and use your best judgment to know, how um what is the best answer. Like all answers could be correct, but you need to like figure out what will be the best answer out of all those
Mm-hmm.
answers in a situation. So it's not, a lot of people have test anxiety, and it's
Yes.
not that you don't necessarily know the information.
Mm-hmm.
It's just a different way of studying and learning and applying it to your field and specialty.
It's crazy. Like I've written so many exams, and even to date, like when I was writing an exam, I have to tell myself, Mr. Man, you've written a lot of exams, and you will not fail. So this one, you're not going to fail. Just trust
Exactly.
yourself. You know.
Yeah.
So I saw someone post something about you guys' exams. They say
Mhm.
there were 5 options, and all of them were like 25, 25, 25, 25. So which one is the correct one?
And that's what I was thinking about when I'm trying to describe these tests because that's what I mean. I'm like, all of the answers are correct, but it's like
Which one is the most
it's
correct
not even
one? Like,
making sense.
and they all look alike.
And they all look alike. That's exactly what I mean. That's what the question I was trying to think of in my head.
And then it was funny. People are beginning to creep into tech exams too. Like there's application
Ah,
exams that we take now. They are so
yeah.
practical and the answers look so much alike. So
Wow.
if you don't know it very well, if you don't know it
Hmm.
like you really know the
Yeah.
application, you're not going to get the answer.
Yeah, you have to
You're not going
really
to
you
get the
have to
answer.
really know it. Yeah.
Yeah.
It's not enough to just memorize.
So
Yeah.
one last question about your personal, dealings. So
Yes.
I mean, we are both Nigerians, and we know how the Nigerian household is. How
Yes.
come you decided to become a nurse and not a doctor?
I did think about, I think it's hard to say that. I feel like most people would, Nigerians, I'll speak for
Yes,
Nigerians, would
that
be
is our culture. It's our
like
culture.
not
Just
most people.
people might not understand why, but it's just our culture. Like that's what we are.
Yeah, most people would think like, or go through that process of, oh, like I might be a physician, I might look at the classes, and then, either it's for you or it's not, and then you
Yeah.
quickly pivot into something else. For me, I did go through that I won't call it a stage, but that period of time, it was a very quick period where I was thinking, maybe I'll go this route. And my dad is a physician as well. So he kind
Yeah.
of inspired me in that way that I was like, maybe I'll go this route. I think when I first laid eyes on what's that class? um organic chemistry.
Okay, 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 okay.
I was like, this is not for me. And you
Mm,
know what? It's not even that a class would really like deter me from pursuing like the career itself, but I think I know how rigorous the field, the training is, and
mm,
the schooling is, and the residency is. And I feel like in order to do that, you need to, anybody can do it, but it's like you have to really be passionate about that and know that that's what you want to do.
mm,
Um, because it's just a lot of schooling and it's a lot of time. And
yeah,
I really admire my friends who go through that and they come out on the other side eventually, but it's not easy at all.
mm,
um, I just didn't find that passion enough to push me through like it's not something that I was like, what, I really, I'm so passionate about this that I'm gonna go through like this
mm,
amount of schooling and residency and everything. And I feel like especially in a field where you're required to have that care for people or specialize in that the area that you want to special, you have to be passionate about it. And it wasn't really there for me, so I went the nursing route. I didn't even know I was going to go the nursing route, but I eventually found my way in that route. I liked how quicker the schooling was. I liked how versatile it was. I was able to find what I wanted to do,
mm.
and quickly enter that space. So
Organic
it just worked out
chemistry.
for me.
Organic chemistry changing dreams.
That's really
I
I was
mean,
like,
yeah,
no thank you.
I did organic chemistry when I was in high school, and
Mm,
it wasn't difficult. It was just tedious. And when I was picking my major, I made sure that the major I picked did not have organic chemistry in it, and that's why I did not study chemical engineering or petroleum and gas when I was in ULAG, because it's just too tedious. Like it's just too much.
it's too
It's too
much.
much.
It's
Yeah.
too much,
It's not difficult, but you just have to just go through the process. And
It,
it takes 10 years to become a doctor, right? Minimum.
I think so. Med school
Mm.
is about 4 years. Residency, I would say like four. I think it depends on
The field.
yeah, it depends, but I would say probably like 10 or more years, maybe
That's
8 to
crazy.
10
That's
years. And I just, I was just like, it's just not for
it's
me.
too much.
And honestly, quite like long term, I don't want to be in a clinical space. I
Mm,
like the specialty that I'm in regards to just like women's health. And I want to continue in that space, but in a
mm,
different capacity long term. So
mm,
I know ultimately when I'm thinking about like long term that I don't want to be like clinical for a long amount of time. I just knew that I didn't want to go go through
mm.
that route. So
So before the end of this show, please remind me to ask you a very controversial question about
okay.
IVF.
Oh God.
Um, let's go into tech. I'm a tech person, and I enjoy technology, and I am always fascinated about how tech can help people.
Hmm.
So, in your own way, how do you think tech has eased your application of helping
Hmm.
people that you've worked with, or in that the first one?
Hmm.
I'm not sure you're doing that much in the second one, but the first one is one like you have to like talk to patients and things.
Yeah. So I think that I think technology streamlines communication in my role every day, and really in just healthcare in general. Um, with I'm sure you're familiar with EHR, like electronic health record.
Yes,
I know we've
yes,
talked about this.
yes.
So that in itself is very important in healthcare in general. In
Okay,
general.
hold on before you
Mhm,
continue. Some
mhm.
people might not know what
Oh,
EMR and AHR is, because I happen to have worked in a tech company that's engaged in that, which I didn't know before I even got into that role. But
okay. So break that. Okay, so EHR is an acronym for electronic health records, and it allows for information like specifically patient records to be made instantly available to like your provider network, like your healthcare team, and outside of healthcare as well. People use EHR, so it stands for electronic health records. In my role specifically, I think it's beneficial in the way that, people don't have to call the office to get results. For example, you can simply review your electronic health record online through the patient portal. You can, if you have questions, you can send a message through the patient portal. Everything is just kind of localized within this record system. And so through my role, a lot of the communication is through patient portal, coordination through patient portal, patients reaching out for questions with any concerns that they have. They use this patient portal. We're able to communicate with physicians and other members of the healthcare team this way. So it's very efficient, very, very efficient. And I think in general, um, technology not only makes our role easier, but from a patient standpoint, um, allowing for just improved access to care through whether it be telehealth, or different applications that patients use, especially in my field. So you're able to just be online. You're able to, not always have to make the trip. You can use telehealth platforms and things like that. So
Mm.
those are two very important technology
So
systems.
what's the difference between electronic health records and electronic medical records?
That's a good question. EHR versus electronic health records versus electronic medical record. I feel like electronic health record, isn't it more wide stream? We only see, I feel like it's more wide stream than electronic medical record. I'm actually not quite sure the main difference. Sometimes I feel like they're used interchangeably, but
Yeah.
but I'm not sure the
Mm.
main difference is.
Mm.
But
I'm listening.
we usually use I always see EHR in my clinic specifically, but I know there probably is a difference, but that's the main one we see,
Mm.
EHR, electronic health record system.
Mm. And so, how do you feel having people's records so easily accessible, such that you know how, like, say for example, I text my doctor because I know he can just pull up my record online or whatever it is. So there's no break,
Mm.
which differently from in the past where you have to like wait for the next day to go and check physical papers to people up the records.
Like, so how do I feel with the quick access that
Yes,
people,
like
like patients can?
there's no day of specific, like you can just call your doctor anytime and say I need
Oh,
this.
okay. Um, I think I can speak for my field specifically, and really a lot of um, other roles in healthcare as well. I think the constant communication is key. So even if it is constant, it is very important. So, like in my role, we have to communicate with the same patients every single day and go over results and coordinate their cycles. So, it's just a lot of continuity to make sure that, um, they're where they need to be. So in
Mm,
my role, people going through IVF, we communicate with them pretty much every day. It involves a lot of coordination because everything is very time sensitive. So, as constant as easy as it is for them to be able to reach out, constantly. I think it is important, to have that constant communication. It's easier than, receiving calls from patients because the main way we communicate is just through the patient portal. And then,
mm,
of course, we have a time where it's like, okay, no one's monitoring after this time. And in that instance, any emergencies they can call, after hours.
mm.
Um, but they're pretty familiar with like the time hours, like between this time and this time is, when the coordination goes on and when I'm able to reach out to my nurse or my physician or whoever they
Uh,
need to talk to.
yeah, because I'm wondering, like, if it's so easy to access, I can just text my doctor 12 midnight and he on his day off, like, Mr. Man, please, what do you like? This is what's going on. Like, what do you think?
Yeah. And I can't speak from a physician standpoint because I know there are physicians. I'm not on call, so I know physicians can be on call, so maybe they, you know,
I mean, being on call is
Patient.
different. Being on call means you are still like working, but you're on
You're
your
still
day off,
working.
you're on your yacht, you are trying to chill.
Oh,
And someone
no,
is
no, no,
texting you, asking you that, oh,
no, no, no,
I'm having a headache. What do you think? Like,
no. No, no, no. It's not that. If you're off, you're off. There'll always be someone there who could take their call. But if you're off, that's it. But of course, like you said, being on call is different. You're still working. But you could still be at home and relaxing, and then somebody will call you.
yes.
Something that may seem kind of small, but it just is part of what comes with the being in the role.
So, what are the popular tech, I would say, products that you have used that
Mhm.
has eased your work?
I would say I wouldn't, not specifically products, but I think in IVF, and I'm gonna like quickly define because maybe some people don't know what IVF is, but just just for like quick background, basically a lot of patients are coming in to take individuals will take injectable medications, which will then help to stimulate egg growth. Once your eggs grow to a good size, they now retrieve those eggs from the body, and then they take them to our lab where they now inject the eggs with sperm and they fertilize and grow into embryos. So that's kind of what IVF is. It's a type of treatment, but it's also a type of assisted technology, like assisted reproductive technology. So I say all that to say, with that comes a lot of technology used within our clinic, whether it be we use something called PGT, which stands for pre-implantation genetic testing. It's a system where we are able to identify genetic abnormalities in these embryos before they're implanted into somebody. So that's a type of technology that's used. There's another technology that we use where you're injecting a single sperm into an egg to facilitate fertilization. That one is called ICSI, which stands for, it's a long name, intracytoplasmic sperm injection. So there are a lot of like um, tech roles and aspects within the clinic that kind of help to facilitate the entire process. Of course, I'm not like within those specific roles, but it wouldn't be possible without these different technologies around IVF.
Mm.
Um, with some of our patients, they use different applications to help track their hormones and their menstrual cycles, and that's very important in timing different aspects of their treatment with us. So I would say, in addition to just the technology that comes in conjunction with our IVF clinic, it's a lot of apps and digital platforms that patients use to help track cycles and different things.
Mm. So, are you ready for the controversial question?
I think so.
You probably know what I'm about to talk about. So, how do you feel about your your job being obsolete?
Can you explain what do you mean by?
So, how will you feel if you wake up one day and say you don't have a job anymore?
Are you like when I say, are you referring to like what's going on with the whole Alabama ruling?
Yes,
Oh,
yes.
okay.
I
I
was
was
trying
like,
to
what do
trick
you
you. I was trying to trick you.
mean?
But
um, I'm not. I was actually talking. I mean, a lot of people have been talking, obviously, because we're directly affected as well. We're not directly affected because I know this is in Alabama, but that doesn't mean it'll stop in Alabama. It likely, it likely wouldn't. Um, I'm not. I'm not very worried about being out of being out of a role. I think it's more so concerning just the effect that this is just going to have on the world of fertility in general, and
Mhm.
people who are trying to actively conceive or go through treatment, whatever that may look like for them. I think this field is already very inaccessible. Like it's not accessible, easily accessible for a lot of people. So if anything, this just makes it worse. But I think as of now, we're okay in Georgia. So we've been getting an influx of people from Alabama wondering what they're going to do, how to resume treatment with us. And I think it's something that we're still trying to figure out day by day. But I pray, it doesn't take me out of a job.
Mm,
But I'm more so, the concern is more so on just how, the effect that this will have on the patient population. Trying
mm,
to believe, yeah.
mm.
Yeah.
So I think in 2019, it just came like as a shock to me.
Mm-hmm.
I heard in the news that the Missouri health director was
Mm-hmm.
tracking menstrual periods of Planned Parenthood patients.
You said they were tracking which one?
The menstrual periods of
Mm-hmm.
Planned Parenthood patients.
Who
That
was
was in
this that
20.
was tracked?
The health director, Missouri health director.
Oh, you mean like using, like patients who are using the apps?
So he said they had a spreadsheet. She kept a spreadsheet, um, kept a spreadsheet tracking menstrual periods of women. Like, I don't know if you heard about that.
No, no, I haven't heard about this. And was it somebody within the healthcare system, or who was it that was
The top official, health official. So I'm guessing I think it's
tracking?
the state health department. Yes, so the whole state health department.
What that reminds me of is like we have a society. I don't know if this is what you're referring to, but we have a society called SART, which stands for Society of Assisted Reproductive Technology. And so pretty much everything that patients go through in our clinic, we have to report to SART so that they're able to track everything going on, like success rates. And so that is that what you're referring to?
No,
Like,
no. So that's
oh,
different, right? So let me read it out to you.
mm-hmm,
So they said Missouri's top of health official testified Tuesday that this was in October 30th,
mm-hmm,
2019. Time Magazine reported that
mm-hmm.
Missouri's top health official testified Tuesday that the state health department kept a spreadsheet tracking the menstrual periods of women who visited Planned Parenthood in St. Louis, a revelation that has drawn scrutiny and raised questions about whether it is a violation of patient privacy. In
I haven't.
continuation, the spreadsheet which Missouri Department of Health and Senior Services Director Randall Williams said was created to identify patients who had undergone failed abortions, included patients' medical identification numbers, dates of medical procedures, gestational ages of fetuses, and the dates of patient's last menstrual period, the Kansas City Star reported. So, in
Wow.
essence, I'm trying to uh, shed a light on how tech can be used in a diabolical way, and
Mm.
that can go a long way in affecting health and reproductive health of people.
Yeah, no, I actually have not heard about this. That's interesting. I have to read about it, but I think that's actually scary.
It is.
um I guess is tech involved, and you trust, especially as a patient, you trust that the information that you're putting out is, stays within, where you're, putting that information. I mean, it's
Mm.
all a part of HIPAA. You're not you're not supposed to be, no one is supposed to have access to this or be releasing any information. I haven't heard about that though. So
Okay, so let me give you another one. Let me do you one better. It said in Michigan, could info from period tracking apps be used against you if abortion is criminalized in Michigan? You know how women have apps that track, their menstrual cycle and all sorts.
mm,
Are they, giving, I would say, government officials? Do they have back end access to people's, information and how that cycle is? Because for some
mm,
very funny reason, people want to control people's decision when it comes to,
yeah.
and it goes beyond abortion when it comes to reproductive health, and that is what people don't understand. I remember they were asking one of those
Yeah.
I think it's senator, is the House of Rep in Alabama, that, oh, do you know
Mhm.
anything about IVF? And the man was saying, oh,
Mhm.
you should be doing this. And the
Mhm.
question they asked him, he got confused because he probably didn't even read the content of the bill. He just feel like, oh, it involves abortion, cancel it.
Mhm.
So
Mhm.
yeah,
I
so I'm
think
asking you, how do you feel about tech, entering those waters?
I think the word I can describe it is scary. Just because with this, especially with the Alabama ruling, I'm just not I don't think I'm shocked because, I've it's just not shocking. Is it unfortunate and very sad? Yes, but it's not shocking. And I've heard what you said about like with people being hesitant to even use these apps and input their information in this because people are making decisions about women's body and they're not even women who are
Women,
making these
yeah,
decisions. So I've even talked to people who don't use these apps and they're tracking their things on paper
manually.
because they're like, there's no way I'm putting my information in there because in 5, 10, however many years, whatever amount of time, it'll come back to bite us. So
Mm,
I think it's while technology can definitely ease the roles within healthcare, it is quite scary, especially with all of these things going on, because you just really never know where your information sometimes
mm.
go. You just kind of have to trust that it won't be effective, but it is scary. It is scary.
So
I think
for information purposes, can you tell us what's going on in Alabama concerning IVF?
yeah, so recently I think we're all still kind of learning and we're kind of sitting on our seats and wondering what is going
What's
to go
going
on.
on? Mm,
Yeah, but like in general, basically, there was I don't know what year it was, but it all kind of stemmed from a clinic, I believe in Alabama, where a couple had undergone IVF and then somehow their embryos that they created got destroyed, like in the lab. I think maybe the vial dropped or something, and so they now sued the clinic um and accused them of like death of pretty much a child. So I think that it stemmed from that. And now,
oh,
yes,
okay.
and so now they're using this case to rule that embryos are considered children, and embryos are considered have rights like any other baby or child
Mm,
would have rights.
that's
So of course,
interesting.
of course, people are now like, it just it a lot is just involved, and we're just kind of like, what exactly does this mean?
Mm,
There are so many cases, especially in IVF, where let's say you freeze an embryo for later use. You have to now later thaw the embryo. And unfortunately, sometimes it's a very small percentage, but it's not successfully thawed and it may not be deemed viable once it's thawed. So in that case, is the physician or the embryologist now are they going to be
you gotta go
charged?
to jail.
Like because it didn't. So and that's essentially falls into what they're saying, like if we're giving embryos rights as babies or kids, whatever.
Mm.
Right, so
So is it possible to have, like, say, 10 viable embryos?
yeah, it's possible. I
So that
think
okay, I'm listening.
no, go ahead.
So that means, so those 10 viable embryos need to become kids by force.
You
So
said by
now
force.
say I want a child, and I'm going, and maybe like in the next 10 days, oh God, your 10 embryos are alive. Oh. So
You
by
can't
law, you have 10
exactly.
kids.
And it's scary because it's like when you're doing IVF, like ideally, you'll want to create more than one embryo. And that's just because unfortunately doing one round of IVF is not always successful for people. So,
Mm,
you go undergo multiple rounds, and that's because, you could transfer one embryo and it may not be a successful pregnancy, or you could, what I referred to a few minutes ago about genetic testing. You could
yeah.
do genetic testing on an embryo and it could be deemed like, this embryo is actually not healthy. So, those embryos are not really eligible to be transferred. When I say transfer, like transferred into the
Into
uterus
the
for
womb.
pregnancy.
Mm,
Yeah, it's for pregnancy. So, in that case, what will you do? Because you now did genetic testing. They said the embryo, doesn't have the normal amount of chromosomes it should have to be a successful pregnancy. So now, there are just so many things that
Say, oh, guy, oh, she has to carry the baby. Oh. You have to carry
exactly
it
by force.
by force.
Now you have 10 embryos sitting in the, so.
Which is even funny. Like even in Texas, that woman
Mhm.
that I think she died because
Mhm.
the baby wasn't healthy, and they were like, "Is that the child or the mother?" And like, well, unfortunately, because the law says you cannot, have an abortion. So
Mhm.
yeah,
Yeah, it's very, very, very scary, and it's.
and I think they took the state to court, and the state was like, "Oh, well, the baby is not a child." So it's a very funny story. So
Mm.
like they're talking with both sides of their mouth. Well, well,
What
it's
happened?
just it's just it's just crazy, man. It's
Yeah.
crazy.
No,
It's
it's
crazy.
just really, it's very scary. There are just so many situations in which it wouldn't.
It defies logic.
Yeah, I'm trying to figure. You said it perfectly. Like it just doesn't. It doesn't add up.
I think I'm still stuck on if like 10 embryos are potent are good. So you have to put everything inside the womb and say this 10, I gotta carry everything.
Yeah, we're just trying to see, what makes sense. And, we'll have patients who, for example, froze embryos when maybe they're in their 30s, for example.
Yeah.
And now they're now 40 something and they're coming back and they say, what do I need to do? Because I'm not, I'm done having children, but I still have these embryos here. So it's just, they're just like,
Wow.
I
It's like,
think divide.
like a mom. It's like a mom now having a child.
Oh, my mom would cry. I would cry. She would just disappear. I'll have to put out a missing. Where's my mom?
That's crazy.
Yeah, it's very crazy, very crazy. But we'll see. I think the main concern is what is next, really. I think everybody's
Mm.
still trying to figure out, what does this mean for the population trying to conceive and freeze eggs and, do treatment.
And you guys who are in the medical field, like you guys have it really hard because people are just making decisions and you just wake up one day and there's a new policy
And there's a new,
and
exactly,
you're like just waking up and like, what's going on?
exactly, and there's
Yeah.
nothing you can you can do.
And
So,
this is life and death situations, not even like regular
mm-hmm.
like touch and go. Like you have to
Yeah,
decide quickly what you want to do.
exactly,
Anyways,
exactly.
I mean, we didn't want to end on a very sad note, but
There's life.
it's life. Let's thank God for life.
It's
But
life.
thank you for turning up. This was a good conversation.
Of course.
Um, we might have to do this. I keep telling everybody that's come on this show that we'll do a part two of their their episode. But yeah, this is one of the things that we have to do again.
Yes,
We
definitely,
definitely have to do
definitely.
again.
I'll be
Uh,
waiting for my invitation.
yeah,
Thank you for having me. I was like, oh, I'm kind of nervous. I'm feeling like a celebrity to come on here, but
yeah, celebrity now, celebrity.
but no, this is a
Celebrity.
good conversation. I look forward to part two down the road.
Yeah. Ladies and gentlemen, yes, we've come to the end of this episode. Thank you for listening. Share to your friends, and let's keep conversation going.
Yes, yes.
Bye, everyone.
Bye, everybody.